Good evening, everyone, and welcome to another episode of the Healthy Reset, where we'll be discussing all the wonderful topics of menopause. Tonight, Nurse Maria, a wonderful host of the Healthy Reset, will be talking about the 10 essential facts that all women need to know about menopause. I am Dr. Z, and I am just the MC for this event, and I'll be handing over to my wonderful and most spectacular co founder, Nurse Maria, Nurse Joseph. Take it away, Maria. The floor is yours.
Oh boy, thank you very much. Thank you very much, Dr. Khan. You make me laugh tonight. Thank you to all our viewers and all new people who are here for the first time. I want to give you all a special welcome and a special welcome to all my sisters from the Sister Isle. A special welcome to you all who are new to the channel in particular. So tonight, as Dr. Khan said, we're going to deal with 10 essential facts about menopause. So, I am Nurse Maria, Nurse Joseph, and it is my pleasure to be empowering you all through knowledge and education so that we can navigate this aspect of our lives successfully. So it's wonderful to see so many of us out here today taking the time to learn more about a topic that affects millions of women, but it isn't talked about nearly enough, which is menopause. I am thrilled to be your guide through this essential discussion. I have dedicated my career now, that at this aspect of my life. I am firstly a registered nurse, then I eventually became a licensed midwife, and then I transitioned myself to this wonderful, lovely area, which is called sexual health. And this area is very empowering. It has opened a lot of doors and windows for me because this area has brought me into an aspect of my life that has empowered me to even educate my life to when I saw the struggles of what so many women were going through this area that I am in. I decided to dedicate the rest of my life to helping women like myself transition through this sometimes very difficult aspect. Some women have it much easier than others, and some like me, it is like a storm taking place. So this is the reason why I've dedicated my life to this and to give us the knowledge and the support. So supporting women's health, educating us in on this life transition and addressing wellness topics as well. And I'm here today to share some valuable insights and facts about menopause, whether you're personally experiencing it, supporting someone who is, or simply want to be informed. This is the session for you. Why is understanding menopause matters? Why? Now, let's talk about why this topic is so important. Now, if you look at how large the states is, did you know the United States has approximately 1.3 million people or women that go through menopause every year? That is a lot of us navigating this life stage, and yet it is so very still misunderstood, shrouded in stigma, and even ignored in conversations about health and wellness. Menopause isn't just about hot flashes and night sweats. It's a profound biological transition that impacts the whole body, the mind, and long-term health. When we understand what's happening, we are empowered to navigate it with a confidence that we've never had before and to advocate for our needs as women. So I remember speaking to a patient who described menopause as a storm. Just as I said before, it actually does feel like that for some of us, that she didn't see coming. So that means you were unprepared for this storm. She felt lost, confused, and even at times embarrassed to ask questions about what was happening to her and the changes that she felt in her body that she couldn't even explain. That story has stayed with me, and it's a reminder of how important it is to provide knowledge and support so no one feels like they're weathering the storm alone. So let's review. I'll give you a preview of what we want to achieve. The 10 essential facts about menopause to help clear up confusion and address some common myths and give us actionable insights. My goal in this session is simply to increase your awareness about what menopause is, to debunk facts and provide evidence-based information, and most importantly, to empower you, whether for you in your own journey, or to better yet, to support someone in your life. That could be a friend, a co-worker, somebody, family member who may be going through this and seems to be suffering through this. So by the end of this session, I hope you'll leave feeling more informed, less overwhelmed, and ready to embrace this phase with confidence. So let's get started. To begin with, let's break it down to the basics. What exactly is menopause? So let's start with the basic here. Menopause is the most natural, is the natural, as we age, is a natural cessation of menstruation, marking the end of a woman's reproductive years. It's officially diagnosed after 12 consecutive months, or as we say in this part of the world, 12 straight months without a period, and typically occurs between the ages of 45 and 55, with the average age being at 51. Now, it's important to understand the three key phases associated with this transition. There is the perimenopause phase, this is the transitional phase leading up to menopause. It can last several years, during which hormone levels fluctuate and you may start experiencing symptoms like not being able to sleep straight during the night. You get up at times and you're just not able to go back to sleep, or sometimes you fall asleep and you're not getting your full straight hour sleep. And it becomes very overwhelming because it's something that happens on a regular basis. You start to get tired, stressed out, and it can lead to a host of other physical and emotional symptoms. So that's some of the symptoms that can happen in the perimenopausal phase. Menopause. This is the point when menstruation, periods, as we know it, has officially stopped. No more bleeding. So you have to go through 12 months straight of not having a period to say, well, yes, I have arrived. No more periods. And then there's the post-menopausal phase. This is the phase after menopause, after the 12 months has come, where symptoms may continue. And I must say, some women, for us, sadly, right, it continues long after you have gone through the menopausal phase. Typically, it actually lessens over time, and long-term health changes come into focus here now. Now that we know that what menopause is, now let's talk about why it's a normal and natural part of life. It is actually a natural biological process. Menopause is not an illness or a condition that needs to be fixed. And we need to get to understand that even though it feels like it, it is actually a very natural process or stage that every woman will experience if she lives long enough. However, it's crucial to acknowledge that everyone's experience is different. I am still going through the perimenopause phase. I think right now, from what I'm seeing going on, I am bordering, not the menopause phase yet. I am bordering that menopause phase because I've now started to have irregular cycles. And that is where I am at this point in time. The periods go and they come. And not, I haven't reached the point where I can say I reached 12 consecutive months as yet. So some people go through menopause with minimal symptoms while others face significant challenges, and that's okay. There's no normal way to experience menopause. So by viewing menopause as a natural transition, ladies, we can approach it with the understanding and compassion both for our own selves and for other women. Hence the reason why we are here tonight. So this perspective also helps normalize and open conversations about it, which brings us to the next point. The age range of menopause. It varies. While the average age of menopause is 51, the range can vary widely. Some individuals may enter menopause as early as their 40s or late 30s. I've known women to go into menopause mid-30s, even without having any kind of medical condition or surgery. That in women like these, they can be termed under genetic, right? It is in their family, right? While others experience it further into their late 50s. And I've known one or two patients who experience menopause in their early 60s as well. So several factors influence when menopause occur, including, just as I said earlier on, genetics. Your family history plays a major role. Lifestyle, smoking, for example, can lead to earlier menopause. Medical conditions, treatments like chemotherapy can cause us women, those of us who have gone through chemo, to have start going through menopause at an earlier age, or surgeries such as the hysterectomy, where we remove the womb. It has the partial hysterectomy, where the womb alone is removed and the ovaries are in place. So with that, you don't go into menopause. But when the ovaries are gone as well, you go into that menopausal cycle earlier than was planned. So if you're wondering about your own timeline, looking at your mother's or grandmother's experience can provide some clues. But remember, menopause is unique to each woman, to each individual. Hormonal changes are at the core of menopause. At the heart of menopause are hormonal changes, particularly a decline in two key hormones, which are estrogen, which is responsible for regulating the menstrual cycle, maintaining bone density, and supporting heart health. Progesterone, which is essential, which is the next hormone, for preparing the body for pregnancy during those years of reproductivity. As these hormone levels fluctuate and decrease, they trigger many of the associated symptoms of menopause. So think of it like a dimmer switch rather than an off and on button. These changes happen gradually and they happen over time. So let's explore how these hormonal changes affect the body, and some of the symptoms you might experience. So let's look at the common symptoms, which a lot of women go through. menopause is often associated with hot flashes, that feeling of uncontrollable heat that takes over. And it can last a few seconds to some minutes. But the truth is, symptoms vary widely and can affect different parts of the body and the mind. Hot flashes and night sweats, which are sudden feelings of heat accompanied by sweating. And the hot flashes and the night sweats basically are the same, because the night sweats are really hot flashes that happen during the night. Mood swings, another more common experience, that symptom that we experience during this time, which are fluctuations in emotions. For example, you might be laughing more than the other person or angry more than the other individual. People may be watching you like, is she, how is she so, what was the joke? Why is she so serious? You know? So that affects your moods in a very drastic way, with some women more than others. You get irritable and angry. Somebody may be just making a little joke or just saying something may not even be directed in your direction, and you get upset, and it causes a whole lot of problems. And then there's the anxiety. You're very anxious for things that before weren't a bother to you. So sometimes you start a quarrel in the house with your partner, your children, for all kind of stuff. You're being just anxious and irritable and things like that. So, and then there is also fatigue and sleep disturbances, difficulty falling or staying asleep, which I go through a lot, and many other women. There are also lesser known symptoms that deserve attention here, which are brain fog, which is trouble focusing or remembering things. That common thing that happens to many of us. You go into this room, you went for something, but you can't remember what you went for. You go back out of your room and say, oh, yes, 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 that is what I went for. So all these are another one that comes up very regularly. And let's look at joint pain, and which affects us in the sense of we are getting very achy and the joints are stiff. And then there is the vaginal dryness, which is another lesser known symptom that deserves attention, which can lead to discomfort during intercourse. And I must interject here, this is a very important one, because it can affect our relationship. Because with that vaginal dryness, I would like to interject here, a low libido happens, is the partner to this vaginal dryness, because of the discomfort during intercourse at this time and the dryness, and that may cause a lot of discomfort and bleeding. It makes and the low libido, it is not a very, very pleasurable time for women in this area. So hence the reason why I tell a lot of women, let your partner know what they are going through. Some women just turn off and they have their partners and they're not explaining what's happening, and it can cause a lot of friction with relationships. So it is important for us not to feel ashamed. Let your partner know, hey, let me tell you something. This is what I am going through. I really do have the desire for sex. And since I'm going through this transition, what do you think as a couple we can do together? What are some of the options you have? Let's go to a professional and get some help, because many times it can affect your marriage. And we did a show earlier on that talked about um, divorce during this time, during menopause, is high, because many of us, the partners, a lot of the men, they are not patient, they don't understand, and they leave us, many women, I should say, are left behind with their symptoms because they are not speaking, and they find other partners, sometimes very younger, much younger partners, I must say, right, that can satisfy their needs. So it is a very, very challenging time in terms of relationships aspect as well. While these symptoms can be frustrating, there are ways to manage them. So let's discuss how these lifestyle changes can make a difference. Lifestyle can impact the experience. Your lifestyle plays a significant role in how you experience menopause. Here are some helpful tips. We cannot underestimate how a healthy diet is important. A diet that is rich in calcium, vitamin D, and whole foods can support bone health and reduce the symptoms. It is important that we start to eat, as we say, clean eating. We try to eat foods as natural and chemical free as possible. Hence the reason why I started during the COVID when prices started to go up with a lot of vegetables, and I realized too that a lot of the um the chemicals that are used on the vegetables that we love to eat and the fruits affect us during this time. I started to grow a lot of my veggies at home, especially the ones I had on a regular basis. So things like what we call it a pak choy in Trinidad. It is otherwise known as pak choy, um, bodi. Well, some people know it as string beans, tomatoes, cucumbers, things that come very easily and that I use on a regular basis. I started to have my own kitchen garden because when you grow your own stuff, you know what you put in your food. And it is very important that we keep that in mind going through menopause. Healthy exercise. Regular exercise, physical activity improves moods, strengthens the bones, and promotes overall health. And we have stress management. We know that this time in our lives, we have a lot of losses that takes place in the sense that it's a time when your children, many of us children, are born to have their own lives. We lost partners, we lost parents. It can be very stressful, and then yes, the stress of the work environment, accompanied by a lot of other things, can cause the symptoms to become exacerbated. So there are practices, stress management practices that you can use. Prayer is one, very, very, very good for reducing your stress and for getting out all those emotions that are hidden inside that we really can't, some things that we really don't want to talk to other people about. There is yoga, you can meditate. Deep breathing exercises also can help reduce the intensity of the symptoms, which is a very good, I've tried it a few times and it works a lot. On this side, on the flip side, certain habits can worsen the symptoms. For example, smoking, for example, has been linked to more severe hot flashes. Excessive alcohol and caffeine can also trigger symptoms. So here's the thing, small changes can lead to big improvements in how you feel during menopause. What are the long-term health implications here? Menopause marks a transition not only in reproductive health, but also in long-term health. Here are 3 areas to keep in mind. Bone health. Declining estrogen levels increase the risk of issues such as osteoporosis, porous or weakened bones, which makes the bones more fragile. Hence the reason why a lot of women, when they fall, they have the hips, the broken hips. They have problems, broken wrists, because of the fragility at the bone at that stage because of declining estrogen, which is estrogen and progesterone particularly. Progesterone is a precursor for new bones. So when it is declining so much and not being replaced as fast as it used to, the bones become weak. Heart health. More women are at risk at this stage in their life to getting heart attacks. Yes, estrogen has a very protective effect on the heart, and with the decreased amounts of estrogen on the heart, the risk of cardiovascular diseases rise after menopause. So hence the reason why a lot of women have problems with high blood pressure cardiovascular diseases. So it's important for us to increase our omega in our foods to help. I use a lot of seafood, salmon, omega-3, healthy fats like avocado oil, coconut oil, and one fat that is a lot of us don't know about as well. Some of us know, some people don't know, is ghee. It's a very healthy fat. It's very good for the heart as well. But as I said, everything with portion, not because it's good for you. We overdo it. We take it, in healthy portions as well. Then we're looking at brain health. Some studies suggest a link between menopause and the cognitive changes, such as memory challenges. So here hence the reason why dementia, Alzheimer's, all of these two diagnoses or these health challenges can be linked as well to menopause. By staying proactive, ladies and gentlemen, with regular checkups and a healthy lifestyle, you can mitigate these risks. There are treatment options though. The good news is that there are plenty of ways to manage menopause and its symptoms and to protect your health. There is hormone replacement therapy, which we call HRT, a highly effective treatment that replaces estrogen and progesterone. However, there are risks and there are benefits. So discuss with your healthcare provider to see if it's the right fit for you. Non-hormonal treatments, which is my go-to, supplements like calcium, vitamin D, magnesium glycinate, omega-3, K2. These are a lot of my go-to regular supplements that I use. Also herbal remedies as well. Herbal remedies that I use on a regular basis as well. I've come to know dandelion. Dandelion, that herb, it helps me still with a lot of bloating that I have. So I use that on a very regular basis, as well as I use a lot of clove and spice. So they all have their benefits as well. The spice is very good to help with metabolism and a lot of other natural uses, which we can go into those things again, where we could always go back and go through these natural benefits of these natural herbs that we have in our pantries. And another non-hormonal treatment as well is lifestyle adjustments, like maintaining a healthy diet and exercising. It is so important here. Since my transition in last year when I met Dr. Khan, I had lost 43 pounds. I've more or less has been able to maintain that, and I try to keep as healthy eating as possible. I have a step app which I've downloaded to my phone, and I also have the watch as well. So to keep me going, to keep me active. So even when I'm home on the weekend, I try to put in some steps in as well, beside the activities of exercising and during the course of the week. There's no one size fits all solution. So you have to explore what works best for you and your body and your lifestyle. Menopause affects mental health. Menopause isn't just physical, it can take a toll on your mental health. Some of the common challenges include anxiety and depression, which we knocked on earlier on, which is linked to hormonal changes and lifestyle transitions, mood swings, emotions up and down that can lead to be feeling overwhelmed, especially if you're in a very high stress work environment like mine, being a sexual health and family planning nurse. It and a lot of the other stresses that you go through in the areas where you work, not being understood and trying to, you're trying to let your superiors know how stressed you are, and, somehow they think, hey, you can deal with it, you're back strong, you can deal with it, and you're dying inside. So it is a time that, and thinking about it, that can lead to even more stress during this time. So I've found ways to deal with it, a number of ways. Sometimes it works better than other times, but I've found different ways, and exercise is a very good way. I found something called brain dump, where you write your feelings for the day. You write down your stress and the person who's stressing you, and you deal with that. You get those feelings out, and you rip up that page, throw that away, and the next day you have another page open for whatever stressor that may come your way. So that works for me as well. So it is important to normalize. It's important to normalize seeking help, whether that's through therapy, support groups like ours, or mindfulness practices. You don't have to face these challenges alone, ladies. Finally, the most important step we can take is to talk openly about menopause, like we're doing here, by breaking the silence, break the stigma. We empower ourselves and other women to seek the necessary support, to share experiences, and to advocate for better care. I strongly um hope that, women, when they reach a certain age at work, they're going through menopause, that, they give us some extra time away from work, to deal with some of the problems, because the issues are real and they can be very, very, very stressful more stressful in work environment. Encourage, it is also at this point in time important to encourage conversations with family and friends, build understanding and support. That is what I spoke about, letting your partner know what you're going through, your relatives know, and, ask for help. Don't carry this load burden alone. It can be very, very harmful to your general health. And then you have healthcare providers. Go to them. Ensure you're getting the care you need. There must be someone out there to take us seriously. The more we talk about menopause, the less intimidating it becomes. So let's recap the key points, the takeaway. So let's revisit them, these 10 essential facts about menopause. Well, we talk about what is menopause, which is a natural biological transition marking the end of menstruation. 2, it's a natural process. It's not an illness, but a lifestyle. A life stage with diverse experiences. Also, the age range vary. Most enter menopause between 45 to 55 years old, but factors like genetics and lifestyle play a role. Another point, hormonal changes are central to this transition. Estrogen and progesterone fluctuate, causing symptoms. Some common symptoms, from hot flashes and mood swings to lesser known ones like brain fog and joint pain. Lifestyle matters. Lifestyle healthy habits can ease symptoms and improve your general well-being. The long-term health implications like bone, heart, brain health require extra care. Treatment options do exist, from hormone replacement therapy to non-hormonal remedies. There are ways to manage symptoms. Mental health is affected. Mood changes are normal, and support is essential here. Open conversations, bringing the stigma, breaking the stigma helps to bring out your issues and helps everyone to navigate menopause with more confidence. Remember, ladies and gentlemen, menopause is a manageable transition. By understanding the changes in your body and the changes that your body is going through, it is important. So therefore, seeking appropriate care and finding the right tools. One size doesn't fit all. So find what works for you during this phase, and you will be able to navigate this phase with confidence and resilience. So as we close, I want to leave you with a message of empowerment. You are your best advocate. Seek accurate evidence-based information, ask questions, and don't hesitate to consult a healthcare provider if you need guidance. There are many resources available to help us out here. Here are a few books to explore. There are books like the Menopause Manifesto by Dr. Jen Gunter. There are websites like the North American Menopause Society, otherwise known as NAMS, support groups like ours, either local or online, where you can connect with others who understand your journey. Now, I'd love to hear from you all. Do any one of us have any questions or any experience to share at this time?
Good evening, everyone.
Good
Hi,
evening.
I am Dale. Today, one of my clients, she came to her chronic disease appointment. So she's 66, and she also decided to book a pap smear appointment with me. And I asked her why does she want one now at this stage, and she said just a couple of weeks ago she started bleeding, spotting. And now it is like stringy, pinkish, like a period sort of thing. So I did book the pap smear. I know they say usually age 21 to 65, but what can be causing that bleeding at this point in her life where she has gone through, the over 12 months without a period? And another client also, she started bleeding at 56, like a period. What may cause that?
Generally speaking, when I've experienced a lot of women who've gone through menopause and are bleeding post-menopausally, it can be cancer, endometrial cancer. It can be very well linked to that, cervical cancer as well, other bleeding, because when we transition and the hormones levels drop and you haven't bled for such a long time, it is quite unusual for that to happen. So what I tell a lot of nurses, when you meet ladies like that, you do the pap smear and you make a referral, right? You give them a referral to see a doctor, and they go and do what we call a PIPL, which is is a biopsy of the endometrial area, and they take those cells, send it to the lab to see what is the cause of the bleed at that age. Hence the reason why I tell a lot of nurses who train with us, who train with me, that, do not turn away women when they come after the age of 65. No woman would want to come to any health center after the age of 65 if, something is not going on with them, So many times it is something really serious when that bleeding starts back, when bleeding starts to happen at that time. So yes, you did the right thing, but a referral would have been good for her as well, to follow up to
Right.
see what causes that at that time.
Okay. Okay, thank you. And in addition, with regard to your herbs you use, I use evening primrose. It's good. It relieves rheumatoid arthritis and osteoarthritis, controls hair loss, natural remedy for skin conditions like eczema. Sometimes you find when you're going through the menopause stage, you just start developing some skin irritation. So I find evening primrose also helps. Thank you.
Thank you. So it works well for you. Great. Any other questions or any words to encourage anybody uses any herbs or remedies, home remedies that can be helpful at this time?
Hi, good night.
Good night.
Somebody
Hi.
else is speaking as well. Hi, good night.
Good night. I think somebody else was coming on, so they're probably giving you the chance to speak, and they probably will come on after. Good night. Good night.
Okay. Hi. I just
Hi.
wanted to know how do you know if you are coming out out of that menopause phase? How
You mean when you're transitioning or after the 12 months
after
has
the hot
passed?
flashes and everything? Yeah. How do you know
Well,
that you are now?
in the postmenopause phase,
Yes. How you know that you're coming out of the menopause?
when you're, all right, so yeah, we have the perimenopause, which is the beginning of the menopause, right? When all the regular
Mm-hmm.
cycle starts and the mood swings, the hot flashes, and all these things are coming in a bulk. But you see, in your period still, you're still having a regular cycle. Eventually, the cycles will start to come sporadically. They will come without, usually your period comes on spot. You know for sure when your period coming. It may change in between during the reproductive years if you're stressed or something like that. However, it comes on point. But during the transitioning period and the period as we go into menopause, it starts to become less regular, and bit by bit, you're not seeing it every month, and then the time lapse comes wider and wider. So in terms of it's not coming every month, then you see in 2 months, it's not coming 3 months, and sometimes it may come back, and then eventually you go straight 12 straight months without a period. Then you can say no bleeding for 12 straight months. I am in the postmenopausal phase. I am in menopause. That I'm out. I'm in the post-menopausal phase of the menopausal of this transition. You might just come out of the menopause phase, which is the 12 months of bleeding, and heading into that stage. So there might be a little many women still have a lot of the symptoms still, but you're not bleeding again. So hence they're in that post-menopause phase now. The journey has begun into the post-menopause phase.
And is there after postmenopausal?
No, well, the postmenopause phase would last until the rest of your life. Once you're alive,
Okay, okay,
you'll be postmenopause.
okay, okay,
But what's
okay.
important to note, and what's important, I tell a lot of women too, during the perimenopause phase, it is possible for us to become pregnant. Because remember, you're still seeing your monthlies. That means ovulation is taking place. And so a lot of women have to be very careful at this time if they don't want any babies at this time in their life, which most of us don't, right? So I tell a lot of us, protect yourself until you know for sure that that aspect has passed, because you can get pregnant at this point. I have delivered women who thought they were true and they got caught, right? And so I have delivered women in their 50s, right? So it is important. We call it a lanyap in Trinidad and Tobago. So it is important that you protect yourself during this transitional phase, because you don't know when you're ovulating and you can get pregnant. So that I just wanted to interject that.
Hi, good night, everyone. Thanks again.
Okay, good night, good night.
Thanks. Good night, everyone.
Good
This is
night.
Elizabeth. I'll be 64 this year. Something I believe Miss Williams said just now, and it brought back memories for when I was about to finalize in my menopause. And why I'm saying this is because I had a very painful every single month period as of the age of 21 and going right back down to somewhere by my 55 or somewhere there. And something dawned on me and said, when I am having my very last periods, now, however, my periods came every 28 days, sometimes 24, sometimes 25, but it was within the period of a normal cycle. So I just analyzed it for myself and I said, score of 100, I think when I'm having my last periods, I would not have any pains. Just like that. And I must say that when my last period was there, after having it for every quote unquote 28 days, I had no pains. And that was a sign, that was a serious sign that that was my last period. And it was.
Wow.
Never had a bleeding after, never had a pain after. I was just getting like phantom feeling as though the period's supposed to come and where is it? But nothing, not a trace or nothing like that. The transition was very smooth, but the every month basis of the menstruation itself was very painful, more painful than childbirth. That was the type of periods I had. And I said to myself, somewhere along the line, when I am having my last period, I think my body will change altogether. And it did.
Wow.
Yeah.
See how
So
everybody's different.
that's food for thought.
Yeah.
But in case anybody's having, painful periods, and just one day around 55, 50, 56, 57, somewhere there, they decide, okay, the body decides this is the last, and you realize you have no pains, nothing to worry about. Nothing to be provoked about. It's just, it probably will be the last.
Okay.
All right. That was my experience.
Good. Thank you very much. Thank you
You're
very
welcome.
much. Anybody else?
Hello, good night.
I hear two voices. You all can decide. Anybody, we will listen to everyone. Just decide who
All right,
wants
good.
to. I'm seeing
Hello.
Rachel. I'm seeing Gracelyn.
Gracelyn. Hello, good night from the
Good night.
beautiful island of Tobago. Hello to everyone.
Welcome, 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 and thank you for being here.
Nurse Maria, I think I missed something. You were speaking about spices and cloves and so that. Is it
Yes.
tea?
Yes,
or
I make tea with them. Sorry about that. I make teas with them.
okay, so it is
Yeah.
not nothing to do with ghee.
The ghee, what I was talking about for when we were dealing with heart health, right? I'm
Yeah.
talking about when I was talking about how we have to protect our hearts as women, because during the post-menopausal phase, heart attacks for women at that age group surpass men, right? And it is very important for us to use healthy fats. I was talking about the salmon, having more seafood. Healthy salmon is very good. Healthy fats like avocado oil, the ghee. Ghee is very good. A lot of people don't know you can cook with
Oh,
ghee.
so that's the ghee.
Ghee.
Okay. I
Yeah.
wanted to know what
Yeah, ghee. Right? But as coconut oil, like our grandparents and great grandparents used to make years ago. Nice fresh coconut oil, very good. These are real good fats. And other things we can do too, instead of frying, we can air fry, bake, steam, or meat. Those of us who eat meat, and those who, those of us who use fish, basically, I'm a pescatarian, that use fish, I bake it or air fry it most of the time. There are the occasions, though I'm not perfect, that I feel for a little fried fish. But generally speaking, if I had to fry it, I put it in a very little oil, and I use the avocado or the ghee to fry it. And then I use a lot of the omega-3 on a regular basis as well. It helps a lot. It helps the heart a lot.
Okay. Thank you.
Welcome.
So, hey, ladies, before we take any more questions, Rachel, give me 1 minute. I just need to do this because we're getting a little late and we're probably going to close off a little bit. So, I just want to send this announcement in here. Let me just pin myself to this. So, quick announcement. We are launching our second course. It's called Ultimate Menopause Recovery. It's a 5-week course, and it's going to start on February the 20th. at 7 p.m., all on Zoom. It's online, so you can do it from home. You get access to the recordings. So even if you miss a session, you can come and listen to awesome Maria speak about help you navigate the changes of menopause and do it with ease and not be so overwhelmed. Right? And so you have access to the course. You have access to recordings. If you miss you miss an evening, you can go and look at the recording and just catch up, right? The course is set February 20th starts and 7 p.m. and the cost of this course is 497 TT dollars. So now for those who are watching internationally, right? Yes, we're doing it locally and it's on Zoom. So if you have anybody, you know you're international, you want to join this course, send me a message on YouTube. We'll take a look and we'll be able to send you a link so you can sign up for the course and we will do the conversion for you into US or wherever you are so that you can join us. But for everybody here, $497, it's a beta course, so we want you to join. So we have structured a course, but in order for us to become amazing at what we do, we need feedback from you. So come on, join us. It will also support the community and support the work we're doing to help us provide more valuable information and services for women to navigate menopause. So join us if you can. $497, February 20th starts, 7 p.m. We'll post everything in the WhatsApp groups. We'll talk about it next week again, and you'll have the sign up page and everything. If you haven't seen anything, reach out to Maria, reach out to me. Reach out to one of the team and say, hey, send me something. I want to join the course. All right. That's it for me. I'll pass it back to Maria and Rachel. Rachel, knock out with your question, and then we'll call it. I think that's our last question for the evening, and then we'll call it a night. And next week we'll be back on with more menopause greatness. All right.
Good night.
Good night, Rochelle.
Yeah,
Welcome.
thank you. I am 43 years and I did a hysterectomy recently.
Mhm.
How I will know that I get any first signs of menopause.
Well, as we were saying before, everybody is different, right?
I end up coming
Now,
in late to
without
the
the, I
meeting.
mean, without you bleeding, you did
Yeah,
a total abdominal hysterectomy,
yeah,
right? So some of the symptoms you will have very similar, right? Even if you're not having a period, you would have that moodiness, you would have the anxiety, you would have the hot flashes, the night sweats, the brain fog, but not everything comes at the same time. They
yeah.
eventually, how long ago had you had the surgery?
November, 2 months ago.
Yeah. All right. So you start to feel any difference in your system yet?
The only thing I just feel is like the time when I was around the time that I was supposed to see my periods, my breast just get heavy.
Right. Yeah. So you're still having those you would still have a lot of us would have that feeling that your period want to come, just as how Miss Axwell was saying earlier, that feeling of like your period coming and nothing coming.
Yeah.
Yeah. So that is quite normal at this time
Okay.
too. So there are other symptoms. So what you could do is,
Yeah.
as you experience them, take note. Take note.
Okay.
Right? Take note. This is what happening to me. I find I really getting annoyed with people. I really can't take on no set of noise. I'm very irritable. All of those are signs. That started happening as yet? That irritability?
Well, I saw from day one, so I can't really.
Well, in your case,
But
you will have to look at other things like brain
yeah,
fog. But no, on a serious note, if you are naturally irritable and it has become worse,
yeah,
because what menopause does, it takes a bad situation. For example, if you said you were like that before, it becomes worse,
okay,
right? So just check out yourself as you relate to people and see what is going on, and take a book and start to write out your symptoms. So that would let you know, hey, as we discussed on the program tonight, I really start to have some of these problems. Oh, now we didn't say problems, challenges,
yeah,
right? Some of the challenges. So write it down and take note.
Okay,
right?
thank you.
You're welcome. So,
And Rachel, I gotta say, join us on the course. It's 5 weeks. We'll get you in the right place. You're in the right position, right time to get you
Okay.
going before everything starts to overwhelm or things start to go haywire. You're trying to figure out what's going on. And
All right.
voila, here we have 5 weeks, we get you in the right track. Boom. You're living your life to its fullest without being overwhelmed by menopause. So that's what the course is built for.
Okay then, thank you.
Welcome.
you're welcome. You're welcome. So, I just want to take this opportunity to say thanks to everyone as we progress in our weekly structured discussions. We will continue to bring you more insight on what we'll be offering during the course, so that once you're interested, or you might know anyone who else might be interested, invite a friend, to come online, or to invite them to do the course, because it is very, very important that you know what you're dealing with, so that you could organize your life in a way that could affect your general well-being. So invite a friend, invite your spouse, so thanks again for coming, and we're looking forward to seeing you all next week, where we discuss something else very interesting as well. Thank you all. Wonderful night. Thank you, Dr. Khan.